Hi beautiful people, how are we all doing? Welcome back to my channel. I believe we all are doing great, guys. Today we are going to be talking on professional value. Yes, we are going to start with impaired performance. Okay, so I'm going to read out the question, the scenario I mean to say, and then we are going to start from there. Okay, I just wanted to know that nurses are brilliant. You can do this examination at first sitting. You can actually pass it. Yes, I believe in you and I trust you. Make use of your marking criteria, read it front and back, practice and practice and practice. Okay, the main thing under this professional value is that you are going to note the one that are specific to each of them, and some are general to all of them. Okay, just do it like that, it's gonna help you. Okay, so I'm going to read it out. I'm just having it on my phone here, so I'm going to read it out. Okay, all right. So we are having promoting value and behavior, impaired performance. The scenario is that Carlo, one of the patients, was complaining about your colleague Dana. He said that she reeks of alcohol and weed, so he is requesting a different nurse, right? Okay. Okay. Carlos said she shouted at her and told him that he is wrong and just having hallucination. And Carlo started crying out of fear that she might hurt him or kill him by giving him wrong medication. All right. Now, using your knowledge of the NMC 2018, the code, professional standard of practice and behavior for nurses, midwife, and the nursing associate, consider the professional, ethical, and legal implication of this situation. Please summarize the action you would take in a number of bullet points. This is silent written station. Please write clearly and legibly. Now, the first thing that is peculiar to this, you're going to start by saying, I recognize that my colleague, Dana, is not able to practice effectively as his social behavior poses risk to the patient's safety. Okay, let me come again. I recognize that my friend Dana is not able to practice effectively as his social behavior poses risk or serve as a potential harm to the patient's safety. One. Okay. The next one, which is number two, is I will recognize that my colleague Dana may need additional help in dealing with alcohol misuse. All right, just make it simple, guys, on a bullet points. Okay. Then number three, that is peculiar to this scenario, is that I will recognize and consider the effect of alcohol to my colleague at work and driving home. Okay, and then I will write an incident report of what happens with date and time and sign. Number five, I will report this to the line manager, stating clearly the reason for my concern to maintain duty of candor. Six, I will also escalate this to the Nursing and Midwifery Council. Failure to do so, I will be putting my practice in questioning and my license at risk. Okay, and then another one that is generally for all of them is I will uphold the standards set by Nursing and Midwifery Council, which are prioritize people, practice effectively, preserve safety, and promote professionalism and trust. That is it. If you are able to say this six or seven, yeah, if you are, I said about seven, but if you are able to write five, six effectively, you are good to go. Remember that the first one you are recognizing is that your colleague Dana is not able to practice effectively as his alcohol or social behavior serves as a potential harm to patient safety. Yes, you are recognizing that what he does is wrong, is not nice. Okay, and then the second one is you recognize that this your colleague Dana may need additional help in dealing with alcohol misuse. And then you can now recognize and consider the effects of alcohol to work and for your colleague to drive home. Safety of your colleague driving home. And then you can now say concerning the escalating to the line manager, escalating to the NMC, and then upholding the NMC code. All right, so that is it. It's very simple, guys. It's very, very simple. Okay, still remember that nurses are brilliant, and you can do this. You can do it. You can do it at first sitting, guys. All right, still remember to subscribe to my channel, comment, like, and share. Go Chooks, love you all. Bye.